As we celebrate Women's Voices this month, it brings up the conversation about speaking up when it comes to your own health. That's one of the main missions of the Rose, and joining us this morning to talk more about that is founder and CEO Dorothy Gibbons. Good morning to you, Dorothy. I'm really glad you're here for this important conversation. So let's talk about why it's so important for us to be an advocate for our own health and really watch out for ourselves, listen to our bodies.
Well, nobody else is. I mean, when it gets down to it, we are our best advocates and we know our bodies. And so when we feel like something's going on that shouldn't be, then that's a time we need to be sure that we are talking to our physicians and being heard.
All right, so let's talk about the Rose's Mobile Coach Program and the launch of Hope. I want to make sure that everybody in our area knows about that.
Yes. Hope is our third coach, and it is going to allow us to meet the needs of about 80 mobile partners in their programs all around Southeast Texas. We're very, very excited to have it. You know, this last year has been very difficult for us to meet all of the needs of our partners simply because of social distancing. We're having to take the mobile units twice as often to do the same number of women. So having this third coach means that we're going to be able to start to fill that gap and have a lot more capacity.
And as we've gone on through the pandemic, are you seeing that more and more women are feeling more comfortable with coming out and getting their mammograms and doing those important screenings?
I think they are, Melissa, but you know, one of the things that we have to be aware of is we often delay this. We often forget to go ahead and make that annual mammogram appointment. And this is a time when it's most important to try and stay on top of those services. I think we also have to realize that an awful lot of our women are facing a lot of economic problems right now because of last year. And many of them who had health insurance last year don't have it right now. And so that's, you know, often that's a reason to say, oh, I'll put it off until I get my health insurance. But that's one of the things we hope doesn't happen. And, you know, it's time for us to really pay attention to how difficult this last year has been on women. I know it's been difficult for everyone, but particularly women are really, really having a lot more issues with employment, with cut hours, with trying to handle children at home. And, you know, it's just a time when there's a lot of additional stress. And we sure hope that our populations are really paying attention to what's happening and how they're feeling and taking care of themselves.
Well, and I'm glad you brought up insurance, Dorothy, because we know that Texas has the highest rate of uninsured individuals. So it's obviously a very serious problem here. But that's one great thing about the Rose. Can you just quickly talk to us about how when a woman goes there with insurance, she can help other people in the meantime by being there and going there with her insurance?
Absolutely. When she comes to us, it gives us that base, that foundation, so that we can support and serve uninsured women. And that's screening for uninsured women. We have to remember our uninsured women many, many times need a whole lot more than just that routine screening. So that's why the donations and grants and everything else that we do makes up that difference. But boy, we could not do this work if we did not have the insured women coming to us and helping us to serve this community.
Dorothy, thank you always for talking to us and being such a great advocate for women in our area. And I want to make sure all of our viewers know that coming up at 9 o'clock today, we're going to be talking to a 22-year-old, so young, diagnosed with cancer because she was an advocate for herself, diagnosed through the Rose. And so we're glad to say she's a survivor of it because of all that you do there. Thanks, Dorothy. Take care of you.
Thank you.